Our public service announcement is about sexually transmitted diseases and infections in the geriatric community of Florida. This PSA is done by Group 12, whose members include Casey T., Jose L., Liliana D., Brandon C., Jaquise W., and Maya Woods. Who is suffering? STDs don't care. And in this PSA, we will focus on how STDs do not care about age, specifically old age. STDs and the geriatric community. When people hear the phrase sexual transmitted disease, or STD, the first thing that comes to mind is young people. Surprisingly, this disease is increasing in prevalence amongst the geriatric population of the United States, which is defined as adults over 65 years old. The most common types of STDs are gonorrhea, chlamydia, herpes simplex, hepatitis B, genital warts, syphilis, and trichomoniasis. What are the facts? According to the Center for Disease Control, the incidence of STDs among elders in Florida has reached a historically high point, specifically the incidence of chlamydia, syphilis, and gonorrhea. The highest spike was seen between the years 2005 and 2009, with a 43% increase for chlamydia and syphilis. Moreover, this spike is significantly higher for the same 4-year period in Central Florida, where the cases of chlamydia and syphilis increased by 71% amongst elders. According to Athena Health, as depicted in this bar graph, patients over 50 years old have seen an increase in-office treatments of STIs from 2014 to 2017. Where are the spikes? The spikes are happening in areas where the elderly congregate. Are STDs a concern in nursing homes? Nursing homes in Florida. Men aged 65 years or older saw a 16.7% increase in syphilis diagnosis. In 2014 and 2017, diagnosis rates for herpes simplex, gonorrhea, syphilis, chlamydia, and hepatitis B rose 23% in patients over the age of 60. Range of medications taken by seniors in nursing homes can break down the amount of good bacteria needed to fight off some illnesses. Why have cases increased? According to the seniors, sex lives are up, and so are STD cases around the country. Men 50 and older are the least likely age group in the U.S. to practice proper condom usage. The main reason for this is because adults over 50 are not worried about the risk of pregnancy. Furthermore, the baby boomer generation did not receive proper sexual education in their middle and high school years. Baby boomers were born in an age of sexual liberation, according to Athena Health, which has contributed to the increase in sex among the elderly as well. There are 3 main solutions that can be taken in order to improve the number of STD cases in geriatric communities. Sex education is a great step of primary prevention to be taken in order to spread awareness that STDs are in fact an issue amongst the elderly. Being of an older age does not mean that one should be any less aware of how to take care of their sexual health. So it is important that sex education classes and seminars are held in order to remind the elderly of what needs to be done in order to take care of their sexual health. It is also necessary so that they stay cautious and aware of being disposed to sexually transmitted diseases, as well as knowing the prevalence at which people their age can get them. Another solution is that more condoms should be available in places where the elderly congregate. If condoms are readily available in places like nursing homes, then they will more likely be put to use. In turn, this could aid in a decrease of the cases of STDs, as protection will more likely be used. A third measure of prevention that should be taken is more frequent testing for STDs in the geriatric community. Sadly, there is a negative stigma around elderly people having sex. As a result, older individuals are less likely to get tested and are often going longer than advisable without knowing that they have an STD. But if there was a push for them to receive testing more often, then this stigma could potentially be reversed. Our public service announcement